I'd like to welcome Dr. Jose Almeida, who is the director for the International Vein Congress that we just had in Miami. So, Jose, how did the meeting go?
Yeah, appreciate you doing this, Anil, and Bain Lymphatic University, which, by the way, we had a little dedicated session by Bain Lymphatic University that little cabinet put together. Went quite well. But yeah, this year I was happy. The energy was back to IVC. This is our 22nd year, and I think just as most meetings have learned, this post-pandemic era was a little bit of a struggle to get things back up to speed. But this year we got a really good attendance, close to 500 people. The energy was good. People were happy, and we did a few things different. So as you know, reimbursement is, we're getting squashed. Physicians in general, vascular surgeons, but physicians in general. And we kind of got into some tools that one can use if you want to maintain, an office-based practice. So as we know, many physicians have opted for, um, you know, to be an employed physician either by a hospital group or private equity group or some larger entity, just because it's tougher to make it on your own because of these, reimbursement issues. Um, but IVC, we started 22 years ago as in-office vein surgery when it didn't really exist. So we wanted to put out there these new platforms. It actually started as an in-office stripping meeting. And then right there is when the endovenous revolution came about with all the new devices. And then it just took off because people want to learn about the devices. But the point is that this was an office-based meeting, so this is people that own vein centers is where we really gravitated towards. And it started also as a vascular surgery meeting, but as things moved along, multiple specialties were getting into venous disease, doing it in their offices because these things were, not so difficult to do as a straightforward ablation phlebectomy. So that's what got us here. And then now, and we're the poster child for this. We have this, call it what you will, aesthetics, medical spa, functional medicine piece of our practice that we started a few years ago, basically out of need. And that's half our income right now. And those are cash-based services. So that's a lot of what we went into this year with special sessions, a lot of breakout sessions and workshops. And I had a lot of help this year from a lot of good people, which are, I don't want to bore you with all the names, but I had a lot of help this year helping me put this together. And that's what it was, special sessions on a functional medicine practice, plastic surgeon talking about aesthetics, um, hormone replacement therapy, all these new machines for body contouring and facial rejuvenation and microneedling. And of course, the main track is hardcore veins. We were always hardcore veins. Thursday superficial, Friday deep, and Thursday thromboembolic. That's the general session, and that did well too. And that, all folks from all walks of life come to that one. All the university guys and hospital employed people that really want to develop their vein practice. So yeah, we were happy this year. We did well. It was a good buzz at the Lowe's Hotel on South Beach in Miami, where we always have it. And my wife puts together some entertainment things in the evening that people liked. So we had a good time to boot, and I think people walked away that um, things aren't hopeless. We just need to change our minds a little bit and get around this to develop some cash services in the practice to augment veins if you want to keep doing veins. Maybe you want to do these other things. And the beauty of this is that, I always hate this term, physician extenders. I don't like being called a provider, but, we have a nurse practitioner or a PA, esthetician. They do this, and I keep pointing that way because it's down that way in the hall, dedicated hallway in my office towards that. And I don't have to go down there much unless, there's an issue. I can still focus on the vein practice. And that's what we're all about this year at IVC. I think it was well received. And I think next year we're going to double down on that and do even more dedicated session towards these adjunctive things one can do to, bolster their income in an environment of decreasing revenue and increasing, inflation. So a lot of challenges.
I like the fact that you reached out to plastic surgeons and others. What other, besides plastic surgeons who can help us learn about aesthetics, what other specialists can help us learn? You said hormonal replacement
Yeah,
therapy, sculpting,
yeah,
that there's some other areas that we can need to learn and try to see if it applies to
yeah,
our.
Anil. So we all came up in this sick care model. That's what we know. Hospitals taking care of sick patients, and there's a lot of broken elements to that, as you know. People need to stay well. So, for example, you go to your PCP and you start bitching and moaning about your PCP that they have 10 minutes with you and all they do is push pills on you. Well, that's just the reality of being a PCP now. They can't spend a half hour teaching how to quit smoking and how to tune up your diet and lose some weight the old fashioned way and make some lifestyle changes. And that's what wellness is all about. PCPs and all of us, we're boxed in with these CPT codes. We got to bill these things to insurance. We Usual and customary fees are gone, right? They pay us what they want. We're boxed in. The only levers we have to pull are increase volume, decrease reimbursement, or get some professional billing company to play with all these modifiers and all these Mickey Mouse games that they do with billing now, with all the coding that goes on. So the folks that we reached out to, you'll hear it called wellness, you'll hear it called functional medicine, integrative medicine, Medi Spa. But these are doctors that come from all walks of life. This has been developing for about 10 years, and there's a lot of these clinics developing, and it's about well care. So keeping people well, uh, personalized medicine. I mean, the concierge medicine, it's all boxed into the same type of arena. And what it is for physicians is um, you can take care of folks to keep them well. These are out of the traditional insurance market. This cash-based services. You pay more attention. Get an hour with your patient, and you go down the line on figuring out what their issues are and spending time with them. And if they need, a lot of laboratory work, you do that, personalized laboratory, genomics, metabolomics, the microbiome's a big deal now, and gut health. So these are the types of physicians that we brought in to teach us more about that hormone replacement. And one doc put it real well. So he was an internist, was a hospitalist for years, and got burnout and started this type of practice about 15 years ago. He calls it the wellness trifecta. So he got in through weight loss, developed a weight loss practice, and then on his journey brought in hormone replacement, and then brought in some aesthetics, and they all kind of work together for his practice. We have another female doctor who's an interventional cardiologist, came in about 20 years ago. She stopped interventional cardiology, got into hormone replacement. And as times progressed, then she threw in a little weight loss, threw in a little aesthetics, threw in some, so people can come at it through different avenues. As vascular surgeons, we could come in through it as vascular care. Uh, we take care of clotticus now medically. We, get into quit smoking. Well, we don't talk about much about losing weight and other things and other avenues that one could do for well care for vascular patients. And venous patients, a lot of them are obese, as you know. So we've got a little, weight loss, uh, piece going on here. We use a GLP-1 agonist and microdosing. I've got a DEXA scanner, so I can get body compositions on folks and make sure they're not losing muscle throughout the process. So things like this, and it's just another thing one can do to take care of patients, augment their income, and maintain their vein practice and stay independent in the office.
It also looked like you had a fair amount of discussion about case-based education also, trying to make it very hands-on, practical, and clinically relevant.
Yeah, so on the vein side, we brought back hands-on ultrasound. We did this the first 5 or 6 years, and Jan Sloves kind of took this on, and 2.5 days of dedicated ultrasound in a breakout session. And then our main sessions at the each hour, we break it into hour blocks. Ablation would be an hour, spider veins would be an hour, deep vein stenting for non-thrombotic disease. At the end of each session, the moderator presents some cases for discussion, and those get discussed amongst a panel, and folks can ask questions. And as you know, case-based is a great learning tool instead of just jamming down, PowerPoint data, talk after talk. So you get your PowerPoint, you get your data, and then you get into a little discussion on real world scenarios, and people really seem to enjoy that. It makes it more interactive.
So looking forward to IVC 2025, what do you have planned different or additions or new direction?
I think it's more the same. Just maybe I think we double down this year. Maybe we'll triple down next year. Meaning, and one of the themes was bring your entire office. We offer a package that physician can sign up for, and they can bring their RBT, nurse practitioner, and even office manager. Candy Hammond did a whole session on office management, on billing and coding for venous disease, not so much the cash-based aspect. She and Crystal Boatwright, they did a great job with that. Uh, so I think we're going to keep developing these concurrent sessions so people have more choices, on the evolution of a vein practice, office-based vein practice. And I think we're going to, so the evaluations I've gotten back so far, they want more detail on the actual business of setting these things up. Okay, which device? How much did you pay for it? Why do you choose that one? What are the complications? That sort of thing. What's the break-even point? How many of these can you buy, and how do you pay for them? That sort of thing. We got into super generic conversations 2 years ago. This year we did dedicated sessions, and these are devices, and people just want more. So we'll just give them more next year on details. Yeah. We do everything based on feedback. That's why, evaluations are so important, because I read them and I act on them. If they didn't like something, I try and get rid of that. If they like something, I try and, develop that further. So, yeah.
Sounds like an excellent meeting. Looking forward to IVC 2025 in
Yeah.
Miami,
Yeah.
Florida.
Yeah. One more year, 23 years coming up. Amazing.
Congratulations. Quite a record.
Yep. Thanks a lot, Anil.
Thank you. Be well.